iDiscover College. So you are all very welcome. We'll introduce our presenters in just a moment, but just to let you know that, as is the case with our member webinars, we record these sessions to make them available on catch-up to those that either couldn't attend live or wanted to check back on some information. So I think the recording has just been started. These events are put on by the Trust for members and members of the public to learn about and interact with some of the services that we provide right across the Trust. So if you are interested in future member webinars, do have a look at our website where you'll see future dates listed and future topics. So tonight's event, as I mentioned, is here to focus on our work on iDiscover. So I'll hand over to Joe Fletcher and Georgie Lomas to take us through the session. Georgie, over to you.
Thanks, Richard, and thank you to everyone that's been able to come this evening. Really appreciate that, particularly Richard, as I know that you are on holiday currently. So welcome everybody. My name is Jo. I'm in an interim position as Head of Service for Children's Universal Services and Specialist Services. So I work within our Children's Services Directorate in NHFT, where we have around 37 services, including our newest one, which is iDiscover, and we're here to discuss this evening. I'm going to share my screen. So, Richard and George, I can see you. Can give me the thumbs up if you can see.
Brilliant. Yeah, I can see that, Joe.
Excellent. Okay. Introducing iDiscover today. Many of you will be familiar with iDiscover already, so hopefully we're not going to be covering too much old ground, but some people may not have known very much about it, so I'll try not to bore, and there'll be time for questions in due course. So the iDiscover team, wanted to introduce you to the team first of all. So our team is majoritively made up, in fact, of children and young people and their adult supporters, and I will be referring to adult supporters throughout the webinar today, and really I'm talking about anyone that supports a child. So it might be a family member, it might be a teacher, etc. And we do have many young people that are involved in participation and co-production activity within NHFT. We have a network of children and young people, and they get involved in all sorts of projects and things. iDiscover has probably been our biggest project, well, certainly it's our biggest project to date, and involves the most amount of children and young people because it's a space that really is to represent our wide population. In NHFT, we're really lucky. Our leaders have really invested in understanding how co-production can actually inspire quality improvement within our services. And we do have a dedicated team who's led by the lovely Georgie, who's just disappeared off the screen, but is here. So Georgie Lomas is our team lead and very much our inspiring and expert leader for our children and young people participation and co-production service. And that team facilitate projects with children and young people. They facilitate a youth advisory board, which is an in-person and online board of young people open for all from the age of 13, and where a lot of work is undertaken with a very dedicated and pretty large group of children and young people. Some of our governors did come and meet the Youth Advisory Board some months ago, and all people are invited to kind of get in touch if you're interested in finding out more about the Youth Advisory Board. And I talk about them because actually they're really part of the inspiration behind iDiscover. These are really, really fantastic young people who have really taken on board their roles to kind of represent their peers, making sure that we really do hear from a really wide range of children and young people across our county. The team also facilitate patient experience groups, so we hear directly from people that are using our services, and of course support all of our participation initiatives, including recruitment into all of our services. We are lucky in NHFT that we have this dedicated team, which has really allowed us to understand most of all what our population needs, which led us to iDiscover, and not all areas have that. And I know that we do often received recognition both locally and nationally as an exemplar service, and have worked with a number of universities on a bunch of projects. So I suppose what I'm trying to really acknowledge is actually the authenticity of our approach towards co-production means that I can feel really secure in telling you that this project is truly co-produced and is absolutely in response to what our population have asked for. So the rest of the team you'll see there, so there's me and Sarah Dunn is our project manager for iDiscover. Sarah comes from the Recovery College, who have also hosted in NHFT, been around for a long time and have been absolutely fantastic in supporting us to develop this service. Steph is our amazing administrator, Sarah, our participation worker, who's absolutely incredible, of course, and Sue, who also comes to us from the Recovery College and has a long experience of being a teacher and a trainer and course development. So here's a bunch of our trainers. I'll talk more about what these trainers do as we move through the webinar this evening, but I really wanted to kind of introduce so you could see that some of the faces that you might see if you do get to come along to some of our courses, which we really hope you do. So our trainers represent a broad range of our services within NHFT and lived experience. So that's people that are living with the experience of being a child or a young person, or maybe using some of the services that we deliver here. Outside of the trainers and the rest of the team, we also work really closely with our communications team, who've been absolutely amazing in helping to develop iDiscover and continuing to promote the service. And we have a really, really strong relationship, as I've said, with the Recovery College. So moving on really to what iDiscover is and how we got to this. So I'll take you on the journey, I suppose, of what inspired the creation of iDiscover. So we're all very aware that children, sadly, will experience difficulties as they grow up. Pretty much every child will experience some difficulties as they grow up. And of course, what our job is, as maybe adults around the child or as services that provide for children, is to reduce the impact of those difficulties and help people to overcome them as they navigate their way towards adulthood. But unfortunately, we hear way too often from the population that we serve, so our children, that actually there seems to be a gap in the way to be able to navigate and deal with those difficulties. And this, you know, can really impact on a child's ability to participate and thrive within their world. So we'll all be really aware of the high volumes of demand, we call it. So the high numbers of children that are wanting or needing to access the services that we provide, and just simply not enough resource at times to be able to meet that demand. Also, the way that we commission our services means that very often accessing help and support can feel like it's dependent on a door being opened, maybe via a diagnosis or through the help from another professional, or simply getting in touch with the right person that can tell you the right road to take so you don't fall down within that gap. We hear, you know, there's not enough services or there's not enough understanding, or a feeling that you have to get worse to get help, and actually it's not in our own gift to be able to get the help for ourselves. So we wanted to find a way that would kind of fill that gap, not necessarily meaning, you know, we can't wave the magic wand to open up the doors at all times, but actually we can respond directly to what our community are asking for, so that actually we're able to balance up somewhat the information that we all have about how we can make life feel easier in that moment. Also, kind of behind the reason for iDiscover, as you would expect, is the outcomes that we see in our county. We know that there's an absolute need to improve some of those outcomes for our children. And this has helped us to deliver in partnership with lots of colleagues across our system. So that would be within the voluntary sector, our colleagues in social care, and of course in our local authorities, to understand better from children, young people and families themselves what the rest of that story is. So what else can we be doing that actually helps people to find the right way in the moment that they need that support, or to understand better? So that as parents, we don't have to knock on doors to find out information, or have to wait on a waiting list to find out what would help. Because whilst those diagnoses and health interventions, for example, are really crucial for children to grow up and achieve their best potential, it is often the struggles and strains in daily life that we need to minimise right away to help a child. So we did lots of work with children, young people and families to find out what would be more helpful. And we really had, actually, we want to have the information that you've got. We need to know more about the things that's sitting in people's minds, because they've got the experience of already treading that path. We want to know what it feels like for you to have gone through that. Do I feel the same as you? And being part of that community in itself can immediately feel more reassuring for people. But we also heard that actually children, young people are pretty fed up of hearing from people like me and other, fairly ageing nurses, etc. Sorry, colleagues, but actually don't really want to necessarily hear from me about what I think might help. I want to hear from people just like you. So people that speak the same speaks, share the same language, understand the trials and tribulations and the joys and the opportunities that there are growing up here in Northamptonshire at this time. So wanting to have help from people like me. And that's an underlying principle behind the concept of iDiscover, that it is developed by people like those that will be using it. So developed by children and young people and families for children and young people and families, taking away that kind of professional element that can feel like a barrier. It doesn't necessarily always feel very accessible to everybody. So we want there to be no thresholds or barriers, no waiting lists, no one to say, actually, this isn't yet for you, you need to wait a little bit, but people to be able to make their own choices about what they want to access, so that they can find out a little bit more about the subjects they want to find out about more, and mix with people that understand these subjects in the best way possible, which is to have lived them. Children, young people and families want a safe and inclusive space, so somewhere that fits into their schedules. It's accessible outside of school times, for example, or in a place that feels like it's somewhere they want to go to. And of course, to be able to get that early help and advice as quickly as possible when someone determines for themselves that they want it. And children and young people told us that they want to join the dots between the different places and people that represent their world. So a piece of understanding that's built in one area is shared in a different area. The same narrative is heard in a school, on the rugby pitch, or in the family home, or different households, for example. So having a place that is open for all to access, so that people are hearing the same information. So here in NHFT, we've got about 37 services, children's services that is, that are divided across 3 stacks. Our universal services, which is our health visiting, school nursing services, our specialist services, which include ADHD and ASD assessments, looked after children, speech and language, and our mental health services. So that includes our CAM services, mental health support services, and we work in partnership with our community counselling services and the REACH Collaborative. So there's a host of clinical expertise within those services, and of course, lived experience. Lived experience being the most important element for iDiscover, as I've mentioned. So we're also working with every child in this county. So our potential, therefore, to reach into communities and understand what's going to be helpful, and to be able to share those experiences, bring together people's understanding and inspire change or help, is something that we're in a unique position to be able to do something about. So children have described the areas that they want to have help with, and they want that from a safe and a reliable source of information or a shared learning environment. And they want us to be able to make sure that that's available to traverse across those different parts of their worlds. And our colleagues across the universal services, the specialist services and mental health services, have been working really closely with children, young people and families over the last year to develop some resources and activities that are already available. And we'll come on to those shortly. And of course, to continue to develop more and more in direct response to what's actually going to be needed and helpful. Oh, sorry, I've got a funny setup and I keep losing my mouse. So, as I've said, it is about making sure that the information is widely available, activities are widely available, and that children are sat in the centre of something that can sometimes feel like it's really unconnected. So we really have kind of adopted the idea of being able to join the dots between our communities, our services, our organisations and our families. Because actually, whilst we often talk about it takes a village to raise a child, which it certainly does, very often actually we probably need that child or children or young people that really know to raise the village first. So we arrived at iDiscover. So iDiscover is a sort of children's version of the Recovery College in a very sort of loose sense. And in other areas, there are a number of discovery colleges that have been formed around the country. So it's quite an emerging idea, but it is well proven to be a really successful initiative for families. We worked with children and young people in co-production from the very beginning, and the name, of course, iDiscover was chosen. Interestingly, we've kept, some areas do call it a discovery college, we've kept the college part out because young people didn't want that in the title. And actually that really helps us to understand it's around that balance. It's not being taught, it's about learning together. So it is a community of children, young people, and those that care for them. And it's all about discovering more about ourselves. We're probably not going to be able to remove some of the challenges for children and young people, but it's about discovering our response to difficulties, what will help and what improves our opportunities to be able to really enjoy life as much as we can. And we do this through a range of activities, which I'll take us through in a moment. It's about growing together and promoting wellbeing at all times. And it is that safe space that children have asked for, where everybody's accepted and it's fully inclusive. Co-production is absolutely essential to iDiscover, and all of our resources are being co-produced for children and young people, and most of our courses are being co-produced. There are some courses that are coming onto iDiscover that currently haven't been fully co-produced, and I wanted to kind of raise this because we really are very, very, very keen to make sure that our co-production is completely authentic. However, children and young people were clear that co-production shouldn't be a barrier to being able to access help. So where courses are in existence within services that come onto iDiscover, there will be the insertion of lived experience, voice of the child. It will be reviewed and validated and evaluated by children and young people themselves. And we will always be working hard to embed that co-produced lived experience within those courses. But at times, those courses have been developed by professionals in the first instance. And as iDiscover evolves, all of those courses coming on board will be fully co-produced. But we needed to listen to what children and young people asked for in the first instance, which was, please don't delay. We want to be able to access this. We need that balance of being able to find this information as soon as we want to be able to find it. So iDiscover launched in June with enormous support from our communications team. There was a social media campaign that was led by young peers. Hopefully some of you on here tonight will have seen some of those videos from many of the young people that participated and co-produced iDiscover, and some of those that are delivering the courses as peer trainers, and many that have attended courses as peer learners. We launched our iDiscover Resource Hub and Toolkit on the website, and we began offering a programme of courses for young people and their adult supporters. Our communication plan was delivered by our comms team and continues with quite an intense social media presence in the first instance, and also working in partnership with our partners, so with family hubs and our local authority colleagues, local schools, certainly in the way of the head teacher's newsletter, and other providers of children and young people services, as well as some newspaper articles and a radio podcast. Actually, we were really pleased that within weeks of launching, we were seeing that some of those social media assets and things were being shared in school newsletters and in some GP newsletters and other communications from GPs. So that was really encouraging. So our website is where you'll find out most of the information, of course. Although there is information on there how you can contact the team to have to be walked through it, making sure that we're as accessible as possible. And you'll have seen on the slides there is a QR code and the website address, so please do take some time to explore it. So it introduces the concept of what iDiscover is and how you register, because to be able to participate in any of the courses, you do need to register on that first. There's a ton of activities that are currently available, and there will be many, many more coming as we continue to grow. We did find from children and young people that found the process of signing up could feel slightly disjointed at times. So Georgie went to our Dragon's Den, which is a quality improvement board who will award some investment to services when there is some innovation or an idea that's going to really improve things for other people. So Georgie went along and she did a really great job, and we got some extra money, and our colleagues in our technology department are currently producing a new platform, so iDiscover will be even better in due course. On the Resource Hub and the Toolkit, you'll see that there's buttons that help you to navigate through different age ranges. So depending on the age of the person visiting the website or their child, they'll be able to find subjects that we think are going to be helpful. And many of the resources that have been developed by children and young people themselves are on those buttons already. So for example, we heard from some families that they would like some resource around PICA, and that piece of resource is now available on those thumbnails. We also have a toolkit, which you scroll down on the page, where you'll see these headings, so emotional support, your mental health, etc., etc. And this is a resource kit that has collated our local resources, our local services that are available for children and young people to access free of charge. And most of those don't require a referral from another professional. So people are able to see the range of services that are available, because often we feel that there isn't anything there, and that's because it can be quite difficult to find out exactly what is there if you don't already know. So this has also been co-produced for children and young people, and all of the resources and services that are there have been kind of checked out by young people to kind of validate that they should be on there. So this is really helpful, of course, for families, but I would say also for people that work with children, young people. So, for example, in schools and things that want to be able to quickly find a space that's going to give them the information they're looking for. And our courses, of course. So these are two of our courses that we currently offer. A one-page profile workshop. So one-page profiles are fantastic ways of being able to explain who you are, what works for you, what doesn't work for you, so what you like and what you don't like, things that help you and things that don't, and something you might like someone else to know about. And actually, as a group of staff, all of our children's staff in NHFT are developing or have developed their own one-page profiles so that we can send those out to families and people know what they're going to expect from us by the time they meet us. And I think there's quite a lot of one-page profiles that feature people's dogs. And Dreaming of Better Sleep. So this is a course that was developed by young people for young people. We're currently developing another course that will be for carers and parents of young people. So it's a really fantastic course where young people come along, discuss sleep, and through a sort of guided activity over a couple of hours, produce a bit of a plan and take away some goodies that help them to plan some positive sleep hygiene and ways to kind of overcome some difficulties with sleep. We are monitoring the activity for iDiscover. So we have this super duper platform that tells us who's signing up, because it's really important to us that we make sure that our registrations, the people that are accessing iDiscover, do represent the population that we serve. So we need to be able to know the areas where we're doing well and where actually we might need to reach into communities. And of course, we do monitor the website activity. So this tells us kind of the hits that we're getting on the different parts of the website. So you'll see that we continue to get a good hit rate on the resource hub, which is really good to see. But I think, probably any of us would say there could always be more. We want to make sure it's as useful as possible. So we're always really keen to hear from people what their experiences of using this and make sure that everybody's aware it's there. So these are the courses that we're currently offering, or resources here as well. So we have our recruitment panel training. So as I mentioned, we do make sure that all recruitment in children, young people is done really with children, young people leading that. So it's likely if you were to come for a job in NHFT that you will be interviewed by a young person or potentially a parent or a carer. What makes a good trainer? This was a course that young people asked for. So we do have young people delivering the course, so they wanted to be prepared for that. But then actually some young people that weren't very interested in maybe yet standing up and doing the course delivery were also keen to get some experience and some understanding about how they would do that, and they'd be able to utilise that in their academic settings as well. One-page profiles, as I've mentioned, the peak of information and Dreaming of Better Sleep, and making your own calm kit workshop. I'm really excited about this one. So this has been designed entirely by children, young people. It's a fantastic course, and it helps us to understand what happens when we feel slightly dysregulated and when actually we're so dysregulated that we're no longer able to access that help from maybe an adult around us or somebody else, or the things that we ordinarily think are going to be useful, but being prepared for that moment so that we're able to overcome that moment and understand that was okay. So again, it's a sort of guided activity over a few hours with a expert from CAMS and a expert by experience that talk through feelings, etc. It's actually quite fun, and you get to build your own calm kit. So again, you come away with some things that you can take home or into school, for example. And Level Up Your Online Safety is being delivered by Owen and Young Person with Experience. And this was a subject that was really, really important to many of the young people that we work with, about understanding how we stay safe online. Courses that are currently being developed are how to access and navigate services, the parent or carer version of dreaming of better sleep. What is co-production? We have a video resource about ARFID, which is avoidant restrictive food intake disorder. That's for parents and carers. Sleep in the early years. Living with EBSA. So we know that this was another area that young people were particularly keen for us to have some courses about. Food, mood and body image, and we're planning a school roadshow where we will be able to deliver some of these courses in settings. So moving forward, we will continue with that engagement with children, young people and professionals that support them, ensuring that we are able to capture exactly what families need, because this service must be designed and developed and evaluated by our community, because that is the premise behind it. We already enjoy really strong partnerships with our local providers of services, so the Reach Collaborative, our local authority colleagues, and we're working together to make sure that the range of services and offers that are available in county are either available to book via iDiscover or at least advertised on iDiscover so that you can see exactly what's there and available for you, and to keep promoting this so that we can really encourage the uptake and make sure that we are delivering exactly what children, young people and families need, and ensuring, of course, that it's available for people at the right time. So that's it. Georgie, I'm not sure if you want, I know you said that you didn't want to, but I'm asking you anyway, did you want to add anything?
No, I don't think so, Jo. We wouldn't have been able to get this far, obviously, without our fantastic young people. And like Jo said, they have done an absolutely fantastic job. And I always question how me and Jo and the team are in a job, because they are so good at what they do, sharing their insights, challenges, experiences, and everything that is on iDiscover. Honestly, we can really say has been youth proofed, if you like. Everything goes to our youth advisory board or our young peer trainers. And we do have a young peer trainer on the call, Ellie, who I believe did want to have a few words to say as well. Ellie, are you on the call, and did you want to come in and have a say?
Hello.
Hello.
Anyone who knows me knows that a few words to me, I get a bit carried away. Turns into a bit of an essay, but it's all relevant. So let me just hi, my name's Ellie. I joined as a volunteer with the participation team after a lengthy stay within multiple psychiatric hospitals. I started attending with the want of turning the hurt and struggle I went through into something that can benefit others, and I really do think the participation team has allowed me to do this. I took the role as the youth advisor for the Children and Young People's participation team, as this allowed me to develop further. Attending the youth advisory board meant I got to meet other young people with the same passion of making change within mental health systems for children and young people. And from the youth advisory board, I have met some of the most resilient, determined and kind-hearted people I know. Working together to use lived experience to make change is so powerful, as it's an insight others don't have, and it allows us to make changes to different elements of the mental health services from a perspective of people who have lived through it, an insight most professionals don't have. Through participation, I was able to do my peer support training and now fully trained within that. Through things like the youth advisory board, oh my God, my words. Through the youth advisory board, I was introduced to iDiscover, a vision to extend these positive changes even further, and early intervention and information that is helpful to those who need it, like young Ellie would have needed a few years ago. And I truly believe if it was in my life, I would have progressed much further than I have now. The vision has now been made into something truly incredible. Most things within NHFT young people is now co-produced. Co-produced, as mentioned, is input from different perspectives, that being professionals, parents, young people, and lived experience advisors. Most things are co-produced, even the little things you may not see or notice. Within participation in iDiscover, we even have little doodles that have been produced and approved by those involved. The letters that are received by families have most likely been read over by the young people or those with lived experience to make sure that all elements of it are accessible to all, and even the wording is how we would want it if we were the ones receiving the letter. I truly think the participation team and iDiscover are the exact example of our motto, making change for you, with you, allowing us to have our say on things such as courses produced by not only the team of iDiscover, but also young people and adults that contribute. The participation team changed me as a person in the best way possible. I started attending anxious, panic attacks when leaving the house, fear of speaking out loud and scared of sharing my story. I've lost my space. And now I stand as the youth advisor and helping people and producing and delivering iDiscover courses, sitting on interview panels with professionals for jobs that are way above me. But my input and how I found the interviews is always so valid, and it truly shows that our stories are valid. Our journeys can be used for good, and that all that pain wasn't for nothing. It allows us to make a change that we know is needed because it's what we needed. And our voices and ideas are always heard. It truly is an incredible team to be a part of. Not only does participation and iDiscover help others, but also me. It allows me to do things in the field that I'm so passionate about, and I know I can make a positive impact, and for that I'm so grateful.
Fantastic. Thanks so much, Ellie. That was a really strong endorsement for the work that's going on. And I'm so pleased that that's had a positive impact for you as well. Thanks also to Joe and to Georgie. It sounds like some fantastic work happening in iDiscover. So I do hope we've got some additional questions to come. So we did have a few questions via email, and perhaps we'll start there whilst we're encouraging colleagues to either put additional questions in the chat or to pop their hand up. But we've got a couple here about I guess for the practicalities really of accessing iDiscover. So comments around actually how can we share the information about the platform? So is it something that we can share with parents and others, or are there certain routes for sharing that should or shouldn't be used?
Yeah, and that's a really great question. I'm pleased that you've asked that, because that's exactly what we really need to happen, is to get this information out to as many people as possible. So we do have information being shared via head teachers' letters, our social media, etc. But I think, you know, the reality is children's spaces probably don't occupy those. Many parents don't either. So I really do encourage anybody who has any way to be able to share this to get in touch with us. I think George has already put the email address in the chat. And we'll gladly send you some materials out. We have obviously the digital versions, and we have printed versions as well. I'm always happy to come and talk to people's organisations as well, if that would be useful. And we are hoping to come and do some roadshows in schools. The limiter is that many of our peer trainers are young people and may not be available during the school day, but we'll be doing what we can there to get out to schools.
Fabulous. Thanks, Joan. We've talked a little bit about courses and so forth. I'm assuming that all of this is free. There's no sign-up fee. It's free to access. Yeah. Is that right?
Oh, absolutely. Yeah. Sorry, I should have been clear about that. It's completely free, of course. Yeah. And we, you know, we wouldn't want anyone to feel that they weren't able to participate for any reason. So if people were having difficulties around travel or something, we'd want to be able to help find a route for them. So again, get in touch. The online form is a sign-up form, but there is contact details on there so that we can talk people through or help people to do that, or have a conversation about what to expect.
Great. And the one around how accessible our approach is a question here. Is there an inclusive approach for those with additional special educational needs or disabilities?
Yes, absolutely. So all of our services clearly work with children with additional needs and disabilities, and we have a strong policy to ensure that we are always able to offer reasonable adjustments. So we do have space on the sign up for people to be able to share anything that they might require from a reasonable adjustment perspective, but equally, we don't always know that, do we? In fact, we'll be having a course coming shortly that helps people to identify what the reasonable adjustments might be. And so again, it would be about having that conversation so that we can make sure that we can provide what's needed.
Fabulous, thank you. So some questions here then about our service offer. What services do we have that help people managing anxiety and mental health? And it may be, not putting you on the spot, Joe, maybe that we can follow up with some further resources, but...
Well, I mean, across children's services, we have a range of services. So we have services that are open for all people to be able to access independently, from our 0 to 19 service, so our school nursing teams for those that attend mainstream or are electively home educated. And then we have the special school nursing team for those that attend special educational provisions. We also have our mental health support teams who work in, I think, about 60% of schools across the county, and also our community wellbeing practitioners who cover kind of the rest. So we have that kind of layer of provision as well. And that can be accessed via schools or by getting in touch with our referral management team. But I can give you a poster, Richard, that could be shared that really demonstrates the full range of offer in county. So then we have our CAMS provision, so our children and adolescent mental health services, and this includes our community counselling services, which are obviously, as the name suggests, based in the community. They're provided through the Reach Collaborative, and that's county-wide. So that includes counselling services that are by appointment and drop-in sessions. And we have our CAMS team who deliver the very specialist end of the mental health provision, as well as a consultation line, which people are free to access. So I've got a lovely poster, which was co-produced by children and young people, so I can share that with you, Richard.
That'd be great. Yeah, I'm sure that would be a useful resource for people that have signed up to join today. Thank you. And a question here then about if somebody was participating in one of the courses and needed some immediate support, what arrangements are there? And I think this particularly talks about whether there's access to live chat if it's an online course, but I guess the same goes if somebody were to be involved in person. How does that work?
That's so important, isn't it? So it's always a really important consideration for us when we are delivering courses. The majority of courses that may be triggering are actually delivered face-to-face currently, because we are early days, but I expect that there will be online courses coming in due course. So the model of having someone with lived experience and having the professional in the room means that you have somebody that's very experienced in being able to support someone at that point in time. We have an extra adult as well.
Great, thank you. And then the final one of the questions that we've had in advance is speaking to service provision or activities for older young people, so teenagers, and asking, can we have more activities in this area? There have been some examples such as making toiletries, also teen yoga, meditation classes. Are there any plans to expand the range of activities for teenagers?
Yeah, well, I absolutely love all of those ideas. Sign me up. Yeah, absolutely brilliant. Absolutely. We're early days. We're very ambitious and want to be able to do as much of that type of thing as possible. I think we recognise that saying to young people, come and come to a course and learn about depression might not really be particularly appealing. But yeah, exactly that. So I shall take note of all of those ideas because I think they're perfect.
Great, thank you. So I can't see anybody else's hand up, and I'm wondering whether I've got a slight connection issue because I've got a screen of blank tiles. So if anybody is wanting to come in, could they use the Teams sort of raise a hand or pop a question in the chat so we don't miss you out. So I think we've covered if people are wanting to put ideas forward or to request further information, we've got the email address there that George has helpfully posted in the chat. And I think further up, I saw the link through to the website where there's obviously a range of resources there as well. And indeed, beyond the iDiscover course on the website, it's a whole list of NHFT services and locations that we offer as well. So I don't know whether anybody does have a question. I'm still able to take any questions if so. Is there anything else, Joe, that you wanted to get across, or Georgie, or Ellie for that matter, actually, having participated this afternoon?
I suppose it's real encouragement for people to get involved if anyone's interested, either from a professional point of view. You know, this is about lived experience. It's about the expertise that anyone can bring to supporting this project. And as Ellie's explained to you much better than I did, actually, it's something that has the ability to grow someone's world in a really, really positive way. And actually, I think, Ellie, that really does reflect what we hear from a lot of young people that work with us and deliver courses and things. It's been really helpful for some of our young people to kind of transition between school and university. And actually, you know, what an amazing skill set to have developed at a young age to be able to share and run things, what have you. So yeah, we are keen to make sure that people understand what we're able to provide, but also come and get involved with us. You don't have to be, you know, standing up in front of 10 people delivering a course. You can be involved in the background ideas. Come along to a youth advisory board or sign up and see what the opportunities are. They'll come into people's emails, so you can kind of see, well, actually, that does look like something I'm interested in, and other things I'm not. That's absolutely correct, isn't it? It's about making sure that you're able to use your expertise in a way that feels right for you.
And I'll just add on to that, Joe, that there's also so much that goes on behind the scenes that people don't see. If you don't want to stand up and talk in a room full of people, that's absolutely fine. You can come along, give your input, and it will still be used, even if it's not specifically you stood up there. Like, everyone's input is so valid. Everyone's journey and everyone's story is what makes this. Like, we wouldn't be able to do it with the young people that I work alongside with if we didn't have such a safe and open environment to be able to share our stories the way we are able to. And I think the fact that I touched on, the fact it comes from young people is so important, because we know what's needed. We know what we want. And I think allowing the young people to have such a big say within all of this is really what makes the difference. And I think co-production is what makes this so different and so unique, but also so positive.
So yeah, a great rallying call there for other young people to get involved, whether it's in front of the camera, as it were, or behind the scenes there. It sounds as though there's lots of different ways that people can get involved according to really what they're interested in. So thank you. Right, I can't see any more hands shooting up, so I think in which case then we'll probably move to close tonight's session. So thank you very much to Ellie, to Joe, and to Georgie and other colleagues that have given up their time this evening to share with us the fantastic work that's happening in iDiscover. We'll certainly do our bit to promote the service out through our membership channels. We've got an opportunity for anybody watching that wants to get in touch to link in via the website or via the email address. So please do put any suggestions or questions through. We'll do our best to respond. But the only other thing I was going to say then is do look out for further member webinars that we're putting on different services that are available through NHFT, which again you'll find on our website. So again, thank you very much, everybody, for participating this evening. Have a very good evening.